This is Kuhelika Roy Chaudhary, conveying my heartfelt regards and warm wishes to all the viewers who took their time and are watching this session right now. Today, Voice of Healthcare has come up with a very innovative topic, which is transformation of care delivery through virtual health, the current landscapes. So, in this today's scenario, we have come up in such a situation where everything is getting digitalized. So, it is very important on our part to even digitalize healthcare and grab more and more information and awareness about the current pandemic situation and other such ailments through virtual media. So, to discuss this topic and understand more, I would like to welcome our guest of honor for today's session, who is Amit Munjal, the CEO of Dr. Insta. Hello, sir.
Hello, everyone. Thanks for having me over, Kuhelika. Happy to be here. I've heard so many good things about your new platform here, and appreciate you taking this initiative to bring together the people who are interested in healthcare community or interested in the new things happening in the healthcare world, especially in healthcare technology all over the world.
Okay, so before we proceed towards the fun-filled interactive session, I would like to request you to give a detailed information or a detailed introduction of the journey that you have come through and what you are currently doing to uplift the healthcare scenario of the vicinity.
Oh, sure. So, hi everyone, my name is Amit Munjal. I'm the founder CEO of DoctorInsta. We are the largest virtual healthcare company in India, covering over 4 million lives in Indian market. Uh, Many of the large multinational companies, as well as homegrown domestic companies in India, have chosen Dr. Insta to cover all their employees as well as the dependents of their employees for their virtual healthcare needs because of the quality of the consults that Dr. Insta is able to offer, the bench strength of the pool of specialist doctors that we have, who are also conversant in various vernacular languages, so that people from all over the country could do these consults in the language of their choice, in the specialty of their choice, at the time and at the place of their choice, to offer instant healthcare access to these millions of lives pan-India. Prior to founding Dr. Insta, I was the CFO and head of investments for City Holdings here in US. Before that, I was in investment banking with Bank of America Merrill Lynch and have done prior stints with Deloitte Consulting in corporate strategy and CFO services practice of Deloitte Consulting. In my spare time, I like to travel, work out, read, and try out new restaurants. Although traveling and trying out of new restaurants have definitely taken a hit because of Corona. But we are very glad and very happy to share with you that in the Corona pandemic, Dr. Insta became the de facto choice for the whole country to do the virtual healthcare consults with the specialist doctors, because people have been very concerned, very worried about the contagious nature of the pandemic. And with virtual healthcare platform of Dr. Insta, it offers them a great solution and a very cost-effective and time-saving solution to do those consults as and when these people want. So I hope, Kuhelika, in this long-winded manner, I'm able to address the first question that you posed.
Absolutely, sir. And I'm really glad that Dr. Insta took up the initiative of helping people and of uplifting the current scenario, even in this pandemic situation. So, if we talk about this pandemic situation, we already know that people cannot visit doctors in person. I mean, people have been totally locked down during the entire pandemic situation, and people were not able to visit doctors in person. So, how do you think that this particular facility through virtual media and telemedicine and other such related technology has helped infuse care towards people in this pandemic situation? Because it's very important for every one of us to understand the benefits of the patient's side before we proceed towards the marvelous output of any digital impact.
Sure. So you very rightly mentioned that in this pandemic, when everything was shut down, people had no access to doctors in person. Not
Mhm.
just that, even the doctors were very scared of opening their outpatient department at the clinics because they felt that, okay, they're in a profession where it's an occupation hazard. So they are willing to put their life on the line, but they feel like many of them were living in a joint family setup with aging parents and with young children. So they didn't
Mhm.
want to be a carrier of corona pandemic back to their respective homes and jeopardizing the lives of the young ones and the senior citizen parents of theirs. So in
Yeah.
an environment like this, Dr. Insta came very, very handy. Our consultation volume from pre-corona time to the current times has gone up by 3 times. Overall number of lives covered have also increased exponentially and are increasing exponentially every single month, month after month. And that speaks volumes about the power of telemedicine. I should also give credit to the political leadership of the country, including the Prime Minister of the country, for speaking positively about telemedicine in a pandemic time. In his addressal to nation, he mentioned virtual healthcare a few times. Not just that, the government also expedited the regulatory framework to manage telemedicine in a more optimal manner. So we were happy to have the support of the government in the times like these, because even before Corona, telemedicine should have been a great solution for a country like India,
Mhm.
where the doctor to patient ratio has been very, very low. In fact, one of the lowest in the world.
Mhm.
So, but happy to be in this journey. It took us many, many years to get to where we are today.
Mhm.
And, our objective is still a long and far away from us, but we're working, smarter, longer, harder to achieve that objective of universal healthcare for every Indian in the country.
Yes, sir. And you already have mentioned a bit about the role of government in emphasizing telemedicine and telehealth across the vicinity. So I have quite interest in knowing more about this thing. So can you please tell us that what exactly is the role of government in deploying digital health in India? As we can see that government has tried its best to launch applications and to legalize telemedicine over the vicinity. So, can you please kindly tell us that what exactly the role of government has been during this pandemic situation in emphasizing digital healthcare for now?
Government had a very important role to play. Government in the past was concerned whether they should formally legalize telemedicine or not. Government was already doing Sehat, which is like social endeavor for health and telemedicine. But since health has been a state subject, so different states had different rules, regulations, and policies around telemedicine. Central government took a leadership role in working with these states to make sure that no specific state throws a monkey wrench in the wheels of telemedicine. So that was the most critical thing that government did in terms of formally accepting, embracing, and developing the policies around telemedicine. Uh, Government also kick-started this initiative where the health records could be centralized and shared. So in the past, as you may very well know, if you go to a specific hospital and that hospital may have your records, but if you want to go to some other hospital to get a second opinion, or if you want to consult someone else and continue consulting that someone else, then interoperability of healthcare records has not been possible. So government is now strongly encouraging interoperability of the healthcare records. In the past, hospitals would not be forthcoming in terms of sharing those health records with the patient when those health records actually belong to the patient, and patient has every right to take them along to wherever they want to get their next consultation from. So these are some of the initiatives where government's role was very critical, and and we appreciate the support of the government in this telemedicine journey.
Yes, sir. So as for now we can understand that government has played a significant role in transforming care delivery through virtual health. But sir, can you give your opinion towards our viewers that how this teleconsultation and telemedicine had proved beneficial towards evaluating the patients with potential exposure to COVID-19 virus? Because we can already know that people were scared in this pandemic situation. They were scared to visit a doctor in person and explain about their ailments and the potential risks that they were facing. So how do you think that this virtual health or the conveying of care delivery through virtual health has helped the patients in evaluating their potential risks?
Tremendously, I would say. And here is how. So initially there were so many myths and misconceptions about corona. And with telemedicine, with just a quick video or phone consultation with the patient, these patients could get evaluated whether they even have corona, or they are unnecessarily being worried about corona because none of their symptoms would be close to what they would experience in corona. So it basically alleviates those anxieties and those fears in the minds of these patients about the corona when corona was relatively new. Also, in the pandemic times, as we were talking earlier, that in the past, everything was shut down, at least in
Yes.
in lockdown state in the country, as you very
Yes.
well know. So in times like those, if you have a young child or a aging mother, there were no doctors accessible to you. All doctors had also shut down their respective clinics because of the unknown nature of the pandemic. So in times like those, telemedicine became a lifesaver for these people uh, to get those consults so that the doctor could prescribe them the medicine. Prescription goes to them immediately at the end of the consultation, and now they can get those medicines fulfilled through the prescription as well, through their neighborhood pharmacy or through online pharmacies, whatever works better for the patient in this. So you don't have to go anywhere. You just need a smartphone or a computer to do the video or a phone consultation with the doctor. Your prescription comes handy to you via email as well as inside the Dr Insta app. And now if you feel like, you can even get those medicines delivered through the neighborhood pharmacy or the online pharmacy. So medicines also come to your doorstep. If the doctor has prescribed certain tests, then Dr. Insta also has tie-ups with all the leading diagnostic lab chains. And you could even go there to get your test done by showing the prescription. Or you can even get a mobile phlebotomist to come to your place to get your sample taken from home, crank out the report, and then share the report with the same doctor and you with your due permission, so that you could do a follow-up consultation with the same doctor on Dr. Insta, saving you a lot of time, energy, efforts, and a lot of hassle, especially during pandemic times.
Yes, I can totally understand how phenomenal and how effective contribution Dr. Insta and all the such organizations have contributed towards uplifting the scenario during the pandemic situation. So, digging more into this topic, as you have mentioned, that online pharmacy worked really well during this pandemic situation. So, I would like to know more about these terms. Can you please tell us that how teleconsultation, patient management, at-home diagnostics, online pharmacy, these things at a blend work together to help patients evaluate any kind of potential risk or provide them complete care. How a person can be diagnosed online over the virtual digital media platforms.
Sure. So, vast majority of the medical problems for which people end up going to a clinic or a hospital could be diagnosed through virtual healthcare. If a
Yes.
doctor, as the doctor is evaluating your issue and diagnosing the problem, the doctor may need the help of certain lab tests. So, doctor would write
Mhm.
those lab tests, and if the doctor has understanding of your medical problem, then the doctor would prescribe you certain medicines too. Now, within the DoctorInsta app, you could order those diagnostic tests so that the
Wow.
phlebotomist comes to your home and collect the sample, takes the sample back to their respective lab, crank out the report, share with your doctor. And the
Mhm.
alternatively, if there are certain medicines that you want to be delivered, then within the app, using your prescription, you can order those medicines at a deep discount, and those medicines will come to your doorstep without your going anywhere. Now, for the diagnostic test, as I was saying earlier, now the doctor has the diagnostic test report as well. So do you. You do a quick button of the follow-up consultation with the same doctor. You choose the time that works best for you. You as a patient also choose the medium that works best for you. Some people prefer phone consultation, some people prefer video consultation. So as you do the follow-up consultation with the doctor, doctor looks at your report and either sticks with the same treatment plan, or based on the results of the report could change your treatment plan. And in most of the cases, almost all of the cases, you would get the same kind of relief that you would have gotten by going to a hospital or a clinic.
That's tremendously overwhelming, sir, to know that everyone has been working significantly in uplifting the society at large and provide benefits to the patients. But, sir, do you really think that digital healthcare or virtual healthcare would take over in future and conquer the entire healthcare scenario over this manual system of visiting doctors in person? Do you think that will take over in due course of time?
No, I don't think so. It doesn't have to. It should not. See, virtual healthcare is a value add. It should work. It should work hand in glove with OPD and other mediums like ICU uh,
Mhm.
of the hospital network. At the end of the day, what virtual healthcare is doing is it is further strengthening the healthcare backbone of the nation. And here is how. One, uh, many a times there are situations and circumstances because of which you are not able to get immediate medical consultation from a doctor, because you know people lead very busy lives in bigger cities,
Mhm.
uh, and many times because of competing priorities you end up ignoring your health and certain symptoms that should have been checked as soon as possible. So
Mhm.
with telemedicine, it saves so much of time from the patient side that you can do a quick consultation with the doctor in 10-15 minutes. You could figure out whether it is something serious, whether it should be explored further, or it is of non-serious nature and you are unduly worried about it. In either of the cases, a stitch at time prevents the other nine. So the early detection leads to early cure. And then with virtual healthcare, the focus is also on prevention. And all these are just about physical, issues. For mental issues too, we have psychologists and psychiatrists. Many times, many people end up ignoring their mental health because of social stigma or because of wide variety of reasons, lack of access to the psychologist or psychiatrist. Now they don't have any reason to. If they have anxiety issues, stress, depression, relationship issues, they can very well do a consultation through their own smartphones, opening the Dr. Insta app and getting connected with the psychologist or the psychiatrist of their choice, and then take it from there. Same thing applies to certain more, intimate natured problems like sexology or gynecology. In the past, people would be thinking twice as to, oh, where should I go to get sexology related consultations? But with Dr. Insta, you can do those consults from the comfort and privacy of your home without worrying about any social stigma that is associated with those practice areas.
That's phenomenal, sir, that telemedicine and virtual health has successfully implemented the method of providing aid in less possible time, and it eliminates the other social factors as well. So, along with these factors, do telemedicine and virtual health also aim at providing cost effective service to the patients?
100%. Look, if you look at, they say time is money, right? So time is money. You take into account how much time does a typical patient spend in seeing the doctor. In bigger cities, it entails driving all the way to the hospital or a clinic, looking for a parking spot, going in circles, finding a parking spot, doing the parking, going inside, paying for the prescription, consultation, and then sitting in the waiting room of the doctor, waiting for your turn to come. And then when your turn comes, you get the consultation in 7 to 10 minutes, you walk out. Again, the same rigmarole of going to the parking lot, getting your car, driving it back to your home or office. End to end, you end up wasting 3 to 4 hours of your valuable time.
Yes,
With
exactly.
Dr. Insta consultation, the whole process of 3 to 4 hours could be squeezed into 10 minutes at the same cost. So net, you're saving 3 to 4 hours of your life in getting those consults. So that's one way to look at it. The other way to look at it is that, in smaller villages, what happens is that people have to go to the nearest big city. So they have to hop on a public transportation system. And that again becomes a very time consuming thing. So with virtual healthcare, all these villagers who are getting more and more smartphone savvy, and the data is also one of the cheapest in India, could do consultations with the specialist doctors in the language of their choice. So if I'm a villager in some village of Karnataka and I want to speak in Kannada with my doctor, I can do so on Dr. Insta platform, choosing a specialist doctor who is conversant in Kannada language that gives me, the joy of speaking with my doctor in my native tongue. So I feel more connected with the doctor, and my prescription comes to me right off the bat. So again, a huge time and money saver for these villagers who earlier in the past would go to a snake oil salesman or a fly-by-night operator or a quack, someone who is not even a real doctor because there was no real doctor available. And so now they don't have to be at the mercy of these quacks, and they can go to the best doctors in the country as and when they want, without worrying about, oh, how to find them, where to find them, and then how to get to those places where these doctors are operating from.
Yes, sir. So this change in the entire scenario, I'm sure it's not a matter of a frisk of seconds. So during this entire journey, so I would like to know what are the challenges that you faced while bringing this entire digital healthcare system into the vicinity?
That's a Fantastic question, Kuhelika. We faced a lot of challenges. Uh, at macro level, challenges were initially about the penetration of smartphones, about the cost of data. Uh, at micro level, the challenges were about adoption and engagement. That how would people adopt this? How would people get engaged on this platform? So over a period of time, I think we got over those micro challenges of adoption and engagement, because once people started using the platform, they were like very happy, very satisfied from the outcome, and they started being the evangelist of Dr. Insta in their extended circle of friends and family members. And as a result of which, more and more people adopted Dr. Insta, and it went to the millions of the households in the Indian market. At macro level, smartphones became cheaper, better, more efficient, and more people, even in smaller cities and villages, started using smartphones thanks to social media platforms like WhatsApp, which brought in so many people in droves to the smartphones. And many of these people initially would have fear of missing out, FOMO, for not having a smartphone and for not being connected to their circle of friends and family members, as WhatsApp became a household name. And then because of the price war that happened between the three incumbent players of telecom service in India, from Airtel, Vodafone to Jio, which led to a price slash of data costs in India, and then more and more people started using data plans or data packs on their phones, and data became very cheap. From being a country with one of the most expensive data, India went in a few years to a country with one of the cheapest data plans. So all the technology companies, including Dr. Insta, are the beneficiary of this lower data plans, cheaper, better, faster smartphones, which are penetrating the Indian market.
So while you have been facing such challenges throughout the journey, what is the one mantra that kept you going on and on and on and bring this change towards the vicinity?
I think one mantra would be persistence. Grit probably would be the one word that I would like to share here, which is like keep on going. If you have a bigger, broader objective in life to accomplish, nothing gets done overnight. So you have to work long, smart, and hard to get over those bottlenecks, get over those hurdles to accomplish the bigger objective that you have set in front of you, which could do some benefit to the humanity.
Exactly, sir. So, lastly, I want to get a message for all the budding healthcare stakeholders and our Voice of Healthcare viewers, that what you want to convey to them regarding this virtual healthcare system that is currently getting introduced in India. And just I want to know about the entire set of advisory that you would like to give our budding people or budding players that who are interested in entering in the fraternity right now.
So your question is advice to the other budding healthcare entrepreneurs
Yes.
out there? Advice to
As
the...
well as our Voice of Healthcare viewers.
Sure. See, I think my advice would be that there are various areas in life where you could be a value add.
Yes.
As an entrepreneur. When you look at healthcare, it's one of the very few areas which have a triple bottom line impact on the society. And when I say triple bottom line impact, I mean, one, what you are doing or going to do in your respective lives would make other people live longer, happier, and be more productive in doing what they are doing, which is a great cause for the society. Second, hopefully whatever you're doing is also net profitable for your investors and shareholders. So that's the second bottom line. Third is the positive impact on the environment. Imagine for every consultation you have to burn fossil fuel because you're taking your car or vehicle or even taking public transportation to get to the clinic or the hospital. And now you don't have to. You can just do it from the comfort and privacy of your home. So that's the third impact, which is a positive impact on the environment, on the greenhouse emissions. So there are very few areas where you could see a triple bottom line impact, and healthcare is definitely one of them. It's a great noble cause that is worth fighting for. India as a market is a humongous market. Very soon we will be the most populous country in the world, beating China. And all these, 1.4, 1.5 billion people need better healthcare. Our healthcare system is broken. Our healthcare system is not universal. Our healthcare system favors the rich. So you as budding entrepreneurs and you as viewers to this VOH healthcare channel have the opportunity to disrupt this, make a better healthcare system, make healthcare universally accessible and cheaper for the whole country. And the kind of satisfaction that you would get from achieving your objective is par excellence. There is no other level of satisfaction that you could get from doing possibly any other thing than by just accomplishing your objective. So you need to have true passion towards solving the problem, and I'm sure you would be able to hit it out of the park. Sure. Thanks for having me over, and for all the budding entrepreneurs as well as the viewers, I wish you happy holidays, which are around the corner. And please stay safe and do whatever you have to do very, very responsibly. Remember, health is wealth, so don't jeopardize it. Do whatever you have to do to keep you as well as yours healthy, wealthy, and wise. Thank you.
So now, as we all know that how miraculous digital healthcare and telemedicine have worked enormously towards uplifting the current scenario, both in pandemic situation and throughout. So I would like to thank each and every viewer who has joined in and has taken time to understand this particular phase of digital healthcare and try to gain information. Thank you so much for joining in. I hope you have a great evening out there. Thank you so much.